Hi everyone and welcome to Atp Live Monday. Okay, just wait a little bit. All right, so good evening everyone and welcome to Atp Live Monday. I am Gbemisola Boyede and it's my pleasure always to be here to answer any questions that you may have about the health of your children. So, welcome from whichever platform you're joining. For those joining on Instagram, on Facebook, you're welcome to ATP Live Monday. And what I'm going to do is to share the video and then we can start to answer the questions. So, and happy Children's Day in advance to our children. Tomorrow is the day, and for us as Paediatricians, we always celebrate our Children's Day with outreaches. And so some of our states will be having outreaches this May, and some also even for the rest of the year. And as you're aware, we're also celebrating our 10th anniversary. So these are all the things going on. So, but let me just first share the video and then we can start. Well, welcome everyone. If you have any questions, feel free to drop your questions under the comment section. If you're watching on Instagram or on Facebook, if you are watching in the groups, you may have to click on the video so that you will be able to see your video. Otherwise, we may not be able to see it. Okay. So just a minute. I'm still sharing the videos, just making sure everybody can see and everybody can hear. So welcome everyone. Welcome. Thank you so much for joining us. I hope you've had a lovely Monday. It's been a busy one for me, but no worries. Okay, so I'm just sharing the video now, and then we can start. And just for you to remember that if you have any questions after the live session is over, you can also post your questions on our Facebook group from Mondays to Saturdays, and we will answer your questions. So thank you so much for joining us. Welcome everyone. I can see you. Thank you so much for joining us on Instagram, on Facebook. Let's just share the videos so that people can see and they can hear. And I'm also just trying to pin the videos to the groups so that people can see it and they can. Okay, I can't see yet. All right. But if you have questions already while we're doing the sharing, you can start to drop your own questions. If you have any questions about the health of your children, feel free to drop it now, and then we'll try and answer them. So I'm just trying to pin the video to our group so that people can see and they can know that we are online. Okay, I think I'm done with all the sharing. Just a few more. Okay. Okay. All right. So I'm done with all the sharing now. Okay. All right. So let me welcome everybody once again. Thank you so much for joining us today. And I hope you've had a lovely Monday. But if you have any question, Ask Pediatrician Live is brought to you by Ask the Pediatricians Foundation. And what we do on Ask the Pediatrician Foundation is to support you to raise healthy children. We don't want any child dying from preventable conditions and treatable conditions. And so we do that through our online and offline expressions. Online, we have our Facebook groups and programs like this one, where you can ask any questions that you may have about the health of your children, and you will get immediate answers from a pediatrician. I know there are lots of groups where people ask questions, but what make our own group a little bit different is that you can be sure that when you are asking questions, you are going to get answers from a pediatrician's perspective. So, pediatricians, as you're aware, are the ones trained in health issues as far as children are concerned. So, that's what we do. And beyond what we do online, we also reach out to communities and we do our community medical outreaches. And we also go to schools as well. We also support vulnerable children. And we've been doing that for the past 10 years. By July, we're going to be celebrating 10th anniversary. And we are grateful for opportunity to have reached thousands and millions of lives through this platform. You can post your question in our Facebook groups from Mondays to Saturdays, and we'll be there to answer your questions. You can also read on our website. We have lots of articles there. If you follow us on our social media platform, you will learn quite a lot. And we also have our podcast, our YouTube channel. These are all platforms where you can learn. And our goal is for people to learn and to ensure that no child dies from things that are treatable and that are preventable. As you, some of us may be aware, Nigeria currently we have one of the highest, I think the highest number of children dying before the age of 5, and that is really something we're not proud of. A lot of our children are dying before the age of 1, a lot are dying before the age of 5, and they are dying not from things that are incurable. They're not dying from cancers. They're not dying from HIV. They are dying from simple things that we can treat, simple things that we can prevent. Our children are dying from malaria. They're dying from diarrhea. They're dying from pneumonia. These are things that should not be killing any child in 2025. So what we do in ATP is to make sure we give parents that information, that knowledge, empowerment, so that they can take good care of their children and that their children will not die. And we look forward to that day when no child dies from such a preventable condition. So that's why we're here today again. So if you have any questions on any health issues of your children or anything you want to know or you want to get some clarifications about, feel free to drop your questions now, and then we will try and answer them in the next 1 hour. But if you are just coming and you're watching the recorded program or we are no longer live, remember that you can always come to our Facebook groups Monday to Saturday and you can post your questions there and we'll be there to answer them as well. So thank you so much for joining us. Thank you everybody. You can see those of you on Instagram. Miss Donna, Shifa Girl, thank you, Lorita Mole, very consistently joining us. Thank you so much. I can't see anybody yet on Facebook. I hope our Facebook is showing and people can see us. Anyway, so feel free to drop your questions. And we want to wish all our children again happy Children's Day for tomorrow. Our children, they are the future of our nation. And it is said that how you know how good a nation is how it treats the weakest members of the society. So the way we treat our children is a reflection of how good, how strong our society is. So I hope our presidents and all our leaders will do right by our children. And of course, every one of us is our responsibility to make sure that our children are well and they are fine and that we're doing right by them. All right, I've talked a lot, but I'm just waiting for people to ask questions. So let's see. Right now, I don't have any questions, so I will just keep talking until I get any questions. But I always have things to say when it comes to raising children and when it comes to healthy children. So let's remember the things, sometimes some things look so simple, so common, and we think, okay, why do we talk about them? But we want you to know that uh, things that are simple, they are also still the backbone of, healthy living. So when it comes to children, we're talking about what we call the child support strategies, which some of us are quite familiar with, especially those of you who have been following us. And so I hope we still remember to take our children for their immunizations. Let's not forget that children still need to take their immunization. And if you've forgotten, please remember to. Larita Mo, good evening. Good evening. Say God bless you. God bless you too. Thank you so much for joining us. So I think I got a question last week of somebody asking, I think her husband does not want the child to take immunization. And so please, the children need to take the immunizations. They are very, very important to protect them. So we don't want children to have diseases that they can be, that may kill them, which they don't need to have only if they've taken immunizations. So things like measles, things like tuberculosis, things like some meningitis, bacterial meningitis from pneumococcal bacteria, Neisseria meningococcal bacteria, and Haemophilus influenza bacteria. Those are the three bacteria that tend to cause most of the meningitis in children under the age of 5. And so we want our children not to have those infections, and just taking those immunizations will protect our children. We now even have malaria vaccine. We now have malaria vaccine, which we're going to be giving to our children. We're still rolling that out. So hopefully, good evening, Mary Smelty. Good evening. Thank you so much for joining me. Welcome. So if you have any question, please ask your question. Just on the Facebook group, please remember that if you're on the Facebook group, I won't see your questions unless you click on the video to post that question. So let me just check that nobody is dropping questions directly in the group, because I won't be able to say. But if you click on the video, then I will see your questions. Okay, so we have malaria vaccines as well, which we're prioritizing for children. I think less than 1 for now. Hopefully, but for now is because those are the children that are likely to die from severe malaria. So we're going to prioritize our children who are more likely at risk. So please remember, when they roll it out in your state or your location, please remember to take your children for these vaccines. So thank you so much. Another thing we need to remember. Okay, I have a question here. Miss Tona say, what causes colic in babies, and is there any cure for it? Thank you, Miss Tona. That's a very lovely question. Colic, or more correctly, we call it infantile colic in medical jargons, but still the same thing. All right. So colic is one of those conditions in newborn babies, especially where they tend to cry a lot. They just cry for no apparent reasons, really. We're not sure why they're crying, but they just cry, and you know, and we tend to use the rules of three: children crying for 3 hours, for 3 days in a week, for 3 weeks in a row, for no apparent reason. So this, a child has been fed, the child is not wet, the child is otherwise well, and then they just cry and cry, and we're sure there's nothing else that is really wrong with the child. So most of the time those children just have colic. The honest truth, we are not quite sure why children have colic. We think we have some theories. So sometimes we think whether it's the gas, because we notice that when children have a lot of gas in their tummy, they want to pass the gas, and they feel a little bit of discomfort. I remember the word not pain, because a lot of mothers think, oh, the child is having abdominal pain. It is not abdominal pain, it is not stomach pain, and it is not pain, because it's very important, because I think parents are distressed more about colic because they felt the child is in pain, and the child is in pain and they can't help the child, and that makes the parents even more distressed. So it is not pain, it's just discomfort. So that's why sometimes when they now pass the gas, they feel a little bit of relief and they are fine. Sometimes some children, they just want that cuddle. Sometimes they just want that movements and all that. So we're not really sure why some children have colic, but we definitely know that some things make colic worse. We know that too much of gassy babies, especially babies who are on bottle feeding, because when they suck the bottle, there's a lot of gas in the bottle that they also take in. Children will cry a lot before you comfort them, so they're taking a lot of hair, and that can also make them colicky and all that. So, but one good thing about colic is that it's one of those things that we say it shall come to pass. In other words, it tends to stop. So most children tend to have colic, but by the age of 3 months, it tends to go on its own. So colic does not have any specific um treatment per se. It's not like something you have to cure, that's the way you put it, but there are things that can make it better. So, but different things work for different children. So for some children, when we give them some of this medication that helps them to relieve them of that gas, so like Sametacom, sometimes it helps them. Infacol, that's a trade name. Some children, it doesn't really make any difference. Some children, you just need, that cuddle. You hold them tight, rock them. Sometimes some children, you drive around with them. They like the movement. Some children, the white noise, like, the noise from your fan blowing, or from, some of these noises are now recorded on harps that you can play. And some children, just that kind of suits them. So I think the most important thing is to know what suits your child, and you just suits them, but just know that it will come to pass. So they will stop having those crying and all that. Actually, by the age of 3 months, 4 months, most children will stop having colic. So, and then let's make sure we breastfeed our children. Let's avoid bottle feeding, because since though I know they are making these days what they call anti-colic bottles and all that, so that there's less hair gas being trapped. Let's make sure we bop the babies when they finish feeding, help them to express the gas and all that. But the good news is that colic will always come to pass. So just be patient. And when we're talking about colic, I need to let us know that we should avoid certain drugs. There are some things people give to children, like nospamin, like colipan, buscopan, more or less. Some of those drugs, what they do is to relaxes the intestine. So those children now have difficulty passing stools and all that. We don't generally recommend that. A lot of people also give gripe water and some of those other kind of local urban kind of remedies. We don't recommend that as well. So just to avoid that, because some of those ones have some serious side effects and they are not the best for children. And for those who are first time mothers, I have lots of products on this and lots of detailed answers on for first time mothers, first time companions. So you may want to grab that and you may find it very helpful as well. So, Mr. Nah, I hope I've been able to answer your questions. But if you want to read more about colic, we have a website article on Doc What is Colic. If you go to www.axipediatricians.com, you will definitely get that information about. If you want to read more details about colic, you should be able to get it from there. All right, thank you. Good evening, Jamal. Good evening, um, Monica. Thank you so much for joining us. Feel free to ask your questions. I'll go to the next question. Utuana say, good evening, Doc Amy. My daughter suddenly stopped sucking at her home at 8 months. So we call it child-led weaning. Should I be worried? As it is very discomforting to prepare food at midnight. Okay, your child, I can explain why some children stop feeding at 8 months. Normally, we don't want your children to stop breastfeeding at 8 months. Your child still needs to breastfeed, okay? Your child still needs breast milk, preferably for 2 years and beyond. That's what we recommend. However, sometimes we kind of started the whole thing, whether consciously or unconsciously. I don't want to like blame the mothers, but sometimes some of our practices we kind of start kind of put the babies in that position where they stop breastfeeding. Number one, most mothers, when we are breastfeeding, exclusive breastfeeding, then it's like many of us look forward to that 6 months because it's like, oh, thank God I'm free. But that is actually not true. Breastfeeding does not stop at 6 months. We don't stop breastfeeding and we don't even reduce breastfeeding. I don't know why many of us always, because I get a lot of questions that shows that misconception and that misunderstanding. So people will start telling me, okay, what can I start giving at 6 months? Or should I go and buy formula now and all that? And that impression or that's presupposes to mean breastfeeding is ending now. I need to go get something else to replace breastfeeding. So breastfeeding does not end at 6 months. You are not even reducing the breastfeeding. You are still breastfeeding as much as you were breastfeeding before when your baby gets to 6 months. What we're only saying that at 6 months, breastfeeding is no longer enough and your baby need additional food. So that is why we call it complements. For those who are grammarians, complement means something that add to something. It is a complement. It is not a supplement. It's not a replacement. It is a complement. That's why we call it complementary feeding. In other words, keep breastfeeding as much as you were doing before, but you are now adding gradually the solid food. But because some of us, when we start the solids, we kind of did a replacement. So we don't breastfeed as much as we're doing before. We actually give the child too much of the complementary food. So we want to feed them all the time. For example, when we start complementary feeding at 6 months, your baby only need 2 meals of complementary feeds. The rest should still be breast milk. So 80% of that child should still be breastfeeding and only 2 extra meals of complementary feeds. But sometimes what I get is parents giving the complementary feeds, a pap or whatever, every 3 hours instead of the breast milk. And then we just now give the breast milk as a token. So, and then for those who are working mothers, it's like we are so free because we go to work. So we go to work from 8 to 5, 9 to 5. And so the child is on complementary feeds, especially if we don't express breast milk. So the child just gets used to eating the solid and the child doesn't see the mother to breastfeed. So the child doesn't feel there's any need for me to suck anymore. Honestly, that is actually what happens 90% of the time. We have inadvertently, involuntarily, unconsciously replace the breast milk with the solids, and that is why the child stop. But if you were actually breastfeeding as much as you were doing before, the child will not stop. But sometimes, most time mothers don't even know they are doing that. We don't even realize, but that is what happened. So usually I'll tell mothers, if you go through our guides on complementary feeding, it tells you how many feeds of complementary food your child should have in a day. So that child should only be having two of at 6 months. By 8 months, then it can become three. So most of the night you should only just be breastfeeding. And then whenever the baby is with you, the breast milk feeding should just be ongoing and not stopped. So we don't really want baby to stop breastfeeding. So for your baby at 8 months, I would say put the baby back to the breast, because when the baby starts sucking, the milk will still flow. The milk will still flow. But if your baby completely is not sucking at all, then you have to make sure you buy age appropriate formula. That age appropriate formula is will still be needed because babies still need milk. Unfortunately, the protection of breast milk, we're not going to get it from formula. There is no way all your antibodies, all the protection you have as a mother that you are passing to your baby through your breast milk, there is no replacement for that. We're not going to get that from formula, but at least the milk and all the other maybe vitamins and additions, you can still get it from formula if you're using age appropriate formula, the DHA, some of them fortified with DHA and all that. But the antibodies, those protective agents, we're never going to get that back, which is the sad part of it. But if you can get the baby back on breastfeeding, and it's not too late to get the baby back on breastfeeding, you just have to be. So even like that night, instead of preparing food, why not just put the baby to the breast? If you can do it, you can re-establish breastfeeding. That's what I'm trying to ask you to do. But if you can't, then just give formula. That's all we can do. But I didn't really go into all the details because I know maybe you may still have a baby in future, or you may also advise other people. You will be conscious of it, and so that will help. Then you have the question: why is she always running temperature? The baby should not always be running temperature. That is definitely not normal. If your child was treated for tonsillitis, if the tonsillitis has gone, then the fever should go. If the child is still having fever, something is still not okay. So you definitely need to go back and see your doctors, any of my colleagues, let them evaluate the child again. Some tonsillitis could be recurrent, but we don't want the child having fever all the time, as long as it's not because your room is too, you know, not well ventilated or it's too hot or something. If it's not environmental and the child is always having fever, then please see a doctor so that they can have a proper evaluation of the child. And which is the more reason I also want your baby to go back on breast milk, because that will also protect the baby against that. I hope that's helpful. All right, I got a question from Cynthia Hogua Dima. Just checking Instagram, people that have not missed any of your questions. Instagram, feel free to ask your questions as well. My son of 2 years, 6 months is finding difficult to talk. Okay, he can say some words, okay, but he tends to forget some words he has learned. Okay, if you ask him how are you, he usually responds to it, but he suddenly stops saying I'm fine when you ask him same question. Rather, he repeats after you and said how are you, I'm worried. Yes, I won't say you should be worried. I don't like telling parents to be worried, but worry does not solve anything. But definitely, I'm also concerned because what your child has done is what we call regression of speech. A child who was saying some things before and then stop is what we call speech regression. It's a red flag for autism. Anytime we pick up that, it's a red flag for autism. Also, your child is having what we call echolalia. The child is repeating words. So instead of saying, how are you? I'm fine. Child is saying, how are you back? We call it echolalia. So that also another possible feature. Those children can learn language by saying that, but your child is different. It's saying that your child already knowing the answer is I'm fine and not how are you. So the fact that the child is now echoing and forgetting some of his words, those are two flags from what you've written alone that will make me to be concerned about possible autism. So I think you should do a screening for your child. Let me see whether I can get this Autism Speaks screening link. But if you go to our website, or if you go to our group and just type in MChat, or if you go to Google online, just say I want MChat screening, um, you can just click. It's something you can do online. So if you go and do that online, it will tell you a figure, um, and let me know the figure. So if your child, it will tell you the interpretation anyway as well. So if your child is scoring anything above, what we call, if it's anything above 8 is high, and that means that child needs to have an autism assessment. So you need to see a developmental pediatrician for an autism assessment. If it's a low moderate score between 3 and 7, we will need to see a healthcare professional who can repeat it again. Maybe your health visitor, your speech therapist, they can repeat that. If it is low, then it may not be. But when it comes to screening, I always tell parents it is garbage in, garbage out. It is the answer you give that tells you the response to give. Sometimes parents, we are very nice when we're answering questions, and we're partial. So I always tell parents, I know some of the questions are not always 100% yes, 100% no, but you go for the majority. What is the typical answers? What is the typical way your child responds? That's what you should go for. And that will tell you whether your child needs to have further assessment on the autism pathway or not. So if your child is scoring high on the screening, then I would recommend that you see a developmental pediatrician. If your child is not scoring high for autism and it's just the speech, you can see a speech therapist. Okay. But just those two flags, the regression is always a very strong red flag for autism. We don't tend to get regression in other developmental issues. The most common place where we tend to get regression is autism, except for a child who also had neurological problem. There will be other signs. The child may be having seizures. The child may be very sick. We understand that one. But a child who is otherwise well, whose speech is going backwards, who is forgetting what they used to say before, the number one flag to be ruled out is autism spectrum disorder. Okay, so that's what I would advise you to. If you have any more questions, just ask. Stay online till 7, and I will respond to that. Let's go on. Instagram, I can't see Instagram questions today. Today seems to be Facebook Day. So let's go on with Facebook people. All right, Monica Okezie, say good evening, Doc. My baby is 2 months, 9 days, okay? She's on EBF and she hasn't pulled since 13 days. That can be normal. So babies on exclusive breastfeeding may not pass stools for up to 2 weeks and beyond. But their wives, they're fine. They are not vomiting. Their tummy is not getting hard. The tummy is soft. They are passing gas. They are fatting a lot, and all that. That is completely normal. And then the day they're going to pass the stool is going to be, plenty, maybe sticky, but it won't be hard. It's not constipation. It is completely normal in exclusive breastfeeding because breast milk is already very pre-digested. So most of it is absorbed straight on. And so only a little residue will be left. And sometimes some babies just kind of accumulate it and wait until they are ready to do a big one before they pass it out, but it's not something that will worry me at all. So you say it's more than 2 weeks dyschizia. I'm not sure what you mean by dyschizia. And normal. So your baby not passing stool for more than 2 weeks. It's not yet up to 2 weeks anyway. It's 13 days. It's not 2 weeks. That will be 14 days. But it is up to 2 weeks. It's still normal. Yeah. There's no need to worry. It's something perfectly normal in breastfed babies. Yeah. Okay, you've asked the question. Yeah, you've also given us more answer. So your baby's tummy is soft. Yeah, so your baby is fine. You don't need to do anything. Just leave the baby. You don't have to worry. Don't worry, the baby will pass this too. So worry. Okay. All right. Maurice Matthew, my baby of 2 years always find difficult to pull. 2 years. Now that's the difference between who asked question last now. Monica is a 2-month-old baby who is on breast milk only. Now Maurice is asking question about a 2-year-old baby. So for those who don't put age of their children, you now know why the age is important. Now, for a 2-year-old, they should be passing stools regularly. So everybody have their different bowel movements. Some children move their bowels every day. Some move their bowel once in 2-3 days. But the stool should not be hard. It should always be soft. And so if a 2-year-old is finding it difficult to pull, and the stools are hard, the child is not passing stool, frequently, then that is constipation. It's different from the first 2-month-old, which is not constipation. You give him fruits and vegetables. You drink a lot of water. So you need to make sure you're giving the child lots of water. And also you also need to encourage them to go and poo whenever they feel the urge. Sometimes some of our children these days, with technology and devices, some of us give them, sometimes they feel the urge to go and poo, but they would not, because they are so engrossed in their cartoons on the tablet. And so the urge will go away. And then, after a while, they don't feel that urge anymore. So the stools will kind of accumulate, and that is constipation. So usually if a child is already constipated, we have to treat that constipation. So that is the difference between constipation and the other one. If a child is already constipated, the hard stools that are already inside the bowel, they have to come out. They have to come out, and they can only come out by giving them medication. So we have what we call stool softeners, or something to help they, to kind of help them pass out the stool. So we have different medication, lactulose, Movicol, Laxido. There are many of them. Most of them are medications that your pharmacist can give you without a prescription from a pediatrician. Some of them you need a pediatrician prescription. So see your pharmacist. Things like liquid paraffin too, but they can be quite messy. But we need to treat the constipation. So for Mary's, if your child is already constipated, you need to get the stool out. So we can give oral drugs. Sometimes we even give them animal, like suppository, to kind of help the already the ones that are already inside to come out. Sometimes we have to digitally remove it as well. We have to do what we call a disimpaction. We want to get rid of what is already inside, and then that is when then you now start doing making sure they're drinking a lot of water, making sure sometimes children need to be reminded to drink water. To amaze you, how many of them take their water to school and they just bring it back full. So you have to remind them to drink water frequently, at least not less than 2 liters a day, and then the fruits and the veggies, and let's do away with the pastries and all the junk food as well. And then let's encourage them to move their bowels regularly. So maybe once a day you supervise that they sit on maybe first thing they wake up in the morning, they go on the toilet, whether they feel it or not, they just go. Or last thing at night before they go to bed, they go on the toilet. That will kind of put them in a routine of always opening their bowel at least once a day. And we may need to supervise that they're drinking a lot of water. So if the child is already constipated, you will need to get that sorted first. And then that is when some of your other strategies will work. So if you're not sure what to do in terms of medication, you can see your GP or your general doctors, and they can prescribe something appropriate for the child. I hope that's helpful. All right, so this was my comment for the person that asked a question about the child who has regression of speech. So this is a link for autism screening, and you can screen. If you just, I'm sure they will give you a feedback immediately on what to do, which is why I like it. So you screen, it gives you back the answer straight away and tells you what to do. But if you still have more questions after the screening, feel free to come and ask us on our Facebook group. Or if you're still here, you can ask before our time goes up. All right, the next question, Sylvia Onyebuchi. Good evening, Doc. I'm breastfeeding. I'm on malaria medication. It is for 3 days. Can I continue breastfeeding? Yes, you can continue to breastfeed. Okay. But just generally, whenever you are seeing your doctors, Always let them know you're breastfeeding. If you are sick for any reason, please let them know. And I hope this medication is prescribed by a doctor and you are not just treating yourself malaria, because most of us do that a lot. Please, for the pregnant mothers and the breastfeeding mothers, when you are in those two situations, please, I beg you, don't self-medicate. Don't do it, okay? Don't just use medication. A lot of us just feel, I just feel I should treat myself malaria. I just feel I should treat myself for malaria and typhoid. Please, let's stop it. It's wrong. Especially for pregnant mothers and breastfeeding mothers. You must always only use medication that a doctor has sanctioned. So I always tell mothers, whenever you go to the hospital, you must always tell the doctor, I'm pregnant or I'm breastfeeding. Most good doctors, when we see women of childbearing age, before we put them on medication, we always ask, when is your last menstrual period? Some of you wonder why we ask that question, even though you are not coming for something gynecological, because sometimes you may have to put you on medication and they need to know whether you're pregnant. The same thing if you're doing x-rays, if you're doing all those kind of procedures, because some of us don't know we're even pregnant. So that's why we always ask, so when was your last menstrual period? And if it's something already past, when you should have had another period, then we may want to do a pregnancy test before we put you in an x-ray machine or before we give you a medication that can affect a baby. So always let your doctors know you are breastfeeding and you are pregnant before any procedure, okay, before you taking any medication. And then when you get medication, if you are pregnant or breastfeeding, always read the leaflets. Every medication leaflet has something to say about its use in pregnancy and about its use in breastfeeding. Now, having said that, some of the manufacturers will tell you you cannot use it in pregnancy or you cannot use it in breastfeeding. However, we as doctors sometimes may override some of those manufacturers' recommendation. The reason is that manufacturers go by what they did in trials. So, and usually we don't, when we are doing trials for medication, we don't want to use pregnant women, we don't want to use breastfeeding mothers. So some people have not tested their drugs in pregnant women and breastfeeding mothers, so they will say don't use it because they are not sure. Not because the drug is going to cause any harm, but because those drugs were not tested in breastfeeding mothers at the time that they were being trialed. So if we as doctors, we had experience already that we've used those medication and we are sure the benefit outweigh the risk, it doesn't cause any harm, your doctor can override that recommendation and say you can use it. So something like anti-malaria, ACT anti-malaria, we've used it over time. We know you can use it in breastfeeding, so it doesn't cause harm. Your baby even can use the medication, so it doesn't cause any harm to you or to your baby. So I will say you can use it. But generally speaking, always tell your doctor so that they can double check, and always read the leaflets. Even after you've told your doctor, you still read the leaflet yourself, because you still have a responsibility to make sure you're doing the right thing. So you should breastfeed the baby. There's no problem with that. All right. Just make sure it's not self-medication. That's the only extra bits that we had. Okay, Oluwatosin, yeah, Mr. Good evening, Doc. I would like to ask if it's normal for a 5-year-old to be grinding his teeth while sleeping. So teeth grinding is definitely not normal, if that's a question. But some children is an habit for them, and some children it could be a sign of, it could be part of some other issues. In fact, sometimes some children will tend to have what we call seizures. That teeth grinding can be a subtle sign of seizure. We also tend to get it a lot in children who have adenoids, who are not getting enough sleep, and sleep apnea and stuff like that. But the dentists definitely don't like teeth grinding because it wears off the teeth as well. So the most important thing is to make sure there's no reason why the child is grinding their teeth that is something significant, like seizures and all the other health issues. If there are none, then the only people that want to see you is the dentist. So the dentist will, sometimes they can give you some mouth guards or things you can put in to kind of stop the child from grinding their teeth. So it is not normal for a child to be grinding their teeth. It is not normal, but it does not mean it is sinister. Let me put it that way. So definitely, do we want children grinding their teeth? No. Do most children grind their teeth? No. So I don't know why the nurse should tell you it is normal. It is not normal. Most children are not grinding their teeth. So what is normal is what we expect everybody to do. So something we don't expect people to do, and something that even when children are doing it, we need to deal with it. That is definitely not normal. So if it's normal, we will not do anything about it. So that is not correct. But I understand what she's trying to say. Maybe just trying to reassure you that it's not like a disease that you have to, like, that should be worrisome or sinister. It is not like that. It will call it bruxism, and it is something that definitely we need to deal with. So if you don't have any other health concerns, then I would just recommend to see the dentist, and then the dentist can um, advise you on what to do, or they can give you something to put in. But if there are other health issues or developmental issues, then you should see the pediatrician. So that's just what we advise with respect to that. So we have a lovely video by one of our dentists on this particular subject of bruxism, that is teeth grinding. You may want to check it out on our Facebook group. So if you go to our Facebook group, if you just type it into our search box, it will bring out that video for you. You can watch it, or if you're not sure how to search for it, if you post that question, one of our moderators will help you find the video and show it to you. All right. Okay, Instagram. I don't have any question on Instagram. That's amazing. Okay, today is Facebook Day. All right. Next question, Elizabeth Agunike. Good evening, dog. Kindly speak on flat feet in babies and toddlers. Okay, flat feet is not, it's normal for babies. So there are what we call arches of feet and all that. The physiotherapists are better in explaining all that. But basically, when babies are born in the first 1 year of life, they're actually flat footed. And so that's why you shouldn't be wearing them shoes and stuff. They should just wear the normal, they should just run around with their feet, and or you just put socks if you want to keep them warm. So there's nothing to worry about flat feet in babies, on infants. So as they're getting older, that is when the arches of the feet, begin to form. And if you are now worried that your child is still flat footed, maybe around the age of 2, 3 years, then that is when you can see the physiotherapist or the podiatrist, in fairness. But it's not something that we worry about as long as the child is not bothering the child really in particular, because there's really nothing much we're going to do to it. But the podiatrist and the physio may be able to give you some advice on that. But just for you to know that it can be normal in the first 1 to 2 years of life, and it's nothing to worry about. Okay, but if you have any specific issues around it, feel free to ask. Somebody said, do you go live on ATP Family? So ATP Family is our adults adults hand. We used to go live. We used to have our ATP Family physicians go live, but I think they are kind of tired, or people are busy, let me put it that way. So we've not really had a lot of people having time to go live. And I'm not an adult doctor, so I'm a pediatrician, and I like to abide by my calling. So I like to answer questions that have to do with children. But notwithstanding, if you have any question, post it on our ATP Family. We still answer questions, but I will discuss with Dr. Rotimi when they are going to start going live. But I know we've not been going live for a while, for many reasons. Of course, Jackpot has also not been an issue. So, but no, but yes, we don't go live for now. But if you ask questions, we'll do our best to answer your questions. All right. Onokoya Titilayo. Good evening, Makanicha. Who was claimed as tongue tie? Who is the claimant? Let's start with that. Cry house loud. Okay, now I get a lot of questions on tongue tie, and it's one of my pets. There are some questions that are pet peeves for me, and I think tongue tie is one of them. because a lot of people just like to diagnose tongue tie. And the number of videos we get, number of pictures people post asking me to say whether the child has tongue tie or not. It's quite a lot, and I don't like to answer that. And because we don't worry about a child having tongue tie. So what people say, so our tongue is anchored to to the the mouth through what we call a frenulum, so it's actually a very thin membrane. It is what's tied down your tongue into your mouth. And for some children, that frenulum kind of extend a little bit further to the closer to the tip of the tongue, and that is what we call tongue tie. Most of it is nothing to worry about, and a lot of so-called tongue tie procedures that people do in private hospitals are completely and absolutely unnecessary. So just leave the child. So I've written an article about much ado about tongue tie. I think you should read that article on our website. I think people do a lot of unnecessary worry about tongue tie, tongue tie. Tongue tie does not cause speech delay, if that's what people are worried about. I've said that, we've answered that many times. Any child who has speech delay, it's not tongue tie, because I've seen people who told me they've even called the tongue tie 3 times. At the end of the day, they actually cause more problem, because in the process of cutting tongue tie, when you cut something, you can actually cause like what we call fibrosis, and that's actually when you now created the real tongue tie itself. So please leave your baby's tongue alone. As long as the child is crying and all that, doesn't matter. There are some kind of tongue tie where you have that frenulum is very muscular. It is not a membrane. Most of the so-called tongue tie that people are saying they are cutting is just a membrane that even just putting your finger, it will kind of separate it. That is nothing to worry about, and that will never affect your child's speech anyway. But some children have the proper tongue tie where they can actually not lift that tongue, and the frenulum is what we call muscular, and you can actually see that it extends to the tip of the tongue, and the tongue is just there in the mouth, and the tongue cannot lift. So most people that their babies are crying and lifting those tongue, and then they're asking me to check whether the baby has tongue tie. I'm not worried about those ones. So, but the ones we are worried are the ones that the baby cannot even lift that tongue, and those are the ones that really need surgery to separate the tongue. And usually those are the more serious cases. Majority of children that people are worried about tongue tie, they don't have any tongue tie. Or even if they have it, it's not going to cause the child any harm. So usually I would say if your child is crying, lifting their tongue is nothing to worry about. Even for those people that have the serious kind of tongue tie I mentioned, it is not that the tongue tie will make them not to talk, it's just that their speech may not be clear. So it is about clarity of speech. And so I would say wait until your child is 2 years old and let's see whether the child is talking. If your child is talking normally, please just leave the tongue alone. If your child is talking but the speech is not clear, and the speech therapist, who is a professional, thinks that the tongue tie may be contributing to the poor clarity of the speech, then they will refer the child to have that tongue tie surgery or procedure, just a simple snipping of that frenulum. But if your child is not talking, please don't go and be cutting any tongue tie. It is not tongue tie that causes speech delay. Child who is not talking either has developmental delays, isolated speech delay, or speech delay that could be part of other diagnoses like global developmental impairments, autism spectrum disorder, so many of them. Okay, but never tongue tie causing speech delay or developmental delay in a child. It's very important because in our part of the world, especially in Africa, we focus so much on this tongue tie is just so amazing. So please, and I see people going to call tongue tie, and private hospitals especially, apologies to them, but many of them capitalize on that. So they always say your child has tongue tie, and they are always going to cut it, and you are going to always pay for that procedure. So, but people where we don't worry about that, you will notice that government hospital you don't get to hear a lot of tongue tie because nobody is going to make any money from cutting unnecessary tongue tie. But private hospitals, yeah, they do. Anyway, that's just my opinion. All right, let's move on. Felicia Bussy, good evening. Thank you for your effort, ma. What can I do for my baby of 11 months old who always pull greenish through all the time for more than a month, even after visiting the hospital twice? What did they tell you in the hospital? And medication was given and all that. Okay. Anyway, I don't know which doctor you saw, but greenish stools can mean one, inadequate feeding. That means that child is not getting enough food. We call it starvation stool. So if a child is not eating enough food, they can have greenish stool. And usually it will be like watery and or scanty and greenish. So that is a typical starvation stool. Now, some food, like some of you that give your baby formula, some of those formula has iron or some supplements, or even some of your vegetables, they can actually make the stool to be green as well. So that is from the pigments of the food that the child is eating, and that is a normal thing. That one, you don't, it's not that there's anything wrong with the child. So for example, if you give your child too much of a wedu, like that, what they call it, is it I've forgotten the English name now. I'll remember later. But the grain leaves and all that. Sometimes the child can pass out grainy stool. But you will notice that the stools are normal stool. They are big, they are bulky, but they are just greenish. So that is just the color of food affecting the stool. That is not a disease, and that is completely normal, and you don't need to do anything about that. So, and or if you're using formula as well that has iron, sometimes they can give your baby stool greenish color. Again, those stools will be normal stool apart from the greenish color, and that one you don't need to do anything about it. So infection per se does not cause greenish stool. If your child has diarrhea and it's greenish, sometimes it is because as part of that diarrhea illness, you have not been feeding the child and the child is not eating. And so the child, because what the child is now passing out is what we call the bile. So the bile is the greenish stuff that mixes with food, and that is what gives colors to our stools, but it will change to brown before it is passed out. But if there is no food much in the child's tummy, nothing to mix with, then it will come out on its own, and that's why it's come out as greenish. So it is not any infection and all that. So you need to make sure that your child is eating well, and pay attention to what you're feeding the child, pay attention to hygiene and all that. So if you're doing all that and it is your child is eating well and all that, and the child is having greenish mucoids too, you may have to say doctor, because we also need to be sure there's no intestinal obstruction anywhere, because that's the last kind of situation. But that tends to be more dramatic because the child will also have abdominal pain, there may be the tummy may be swollen. So the one that are due to intestinal obstruction are usually more dramatic because there are other symptoms. So it's not just the greenish stool. The child is ill. The child is having abdominal pain. The child is having painful tummy. When we touch the tummy, it's painful. So usually those ones will end up in surgery. But a child who is passing stools on his own, child is otherwise well, it's either a starvation stool or it's from the pigments of food that you are giving the child. So it can be any of them. And they are very straightforward things to deal with. So if it is from the food, you don't need to do anything. At least you know where it's coming from. But if it's from the lack of food, then you need to give the child more food, and that is all you need to do. All right, I guess my time is up. I got 2 more minutes. But like I said, if you have any questions still about the health of your children, you are welcome to post it to ATP Facebook group. We have 4 groups. And then we have Ask the Pediatrician, which is our major group. And then we have the ATP Family, which is our adults related group. We have ATP Still a Mom for those who need psychological support around loss of pregnancy or babies. And then we have ATP First Time Mom group, which I think is still being I'm still working on that really, but I want to have a group for first time mothers because most of the questions we deal with are first time mothers related. First time mothers, they need a lot of support, and I'm passionate. I'm very concerned and making sure we have first time mothers get it right and not get confused by all the voices around them. So that's that. But yeah, so those are our groups. You can post your questions there Mondays to Saturdays. We're not available on Sundays, and if you also want to learn a lot about any of this topic, almost all the topic I've mentioned today, we have an article on them. We have an article on tongue tie. We have an article on speech and language developmental delays. We have on autism. So there's virtually any topic that you cannot listen or learn more on our podcast, on our YouTube channel, on our website. So we have already discussed them in detail. So I'm just giving you like a paraphrase, of some of the answers. But if you want to do your detailed reading around um, those topics, please visit our website www.askthepediatricians.com and also our YouTube channel, our podcast, Ask Dr. Gbemi ATP podcast on any of the podcast channels. You can go through them, read about them, or listen or watch, and then I'm sure you will learn. And if you still have questions after that, you are welcome to post them on our Facebook groups, and we will try our best to answer them. Just to let you know that ACP is going to be 10 in July and we are celebrating. So just watch out for our posters and flyers on how we're going to celebrate our 10th anniversary. It's been 10 years. And looking back, I'm really, really grateful to God for the opportunity that He has given to us to touch and affect and impact many lives of our children in Nigeria. And we look forward to doing more. And so the whole of the month of July, we're going to celebrate our 10th anniversary. The whole month is going to be celebration, but we want you to be part of it. We want you to, so you watch out for all the things we want from you. We want you to tell us how ATP has impacted you. We're going to be raising funds to do more outreaches, more programs, touch more lives. So look out for that, and then we will keep you updated as well. So thank you so much for joining me. If you're just coming, please just, if you have questions, we're no longer live. Feel free to go to our Facebook group and post your questions there. Oh, somebody just posted a question on Instagram. Okay, Dolly, let me just answer your question because Instagram people have not asked questions for long. So let me just answer that. My child is 5. I hope he's 5 years old. Or is he 5 months old? He has not been treated for like 8 months and has not been treated for like 8 months for adenoid and tonsillitis. Okay, can I say my child outgrows the pain and risks of surgery now? So I guess what you mean is that your child has not had any symptoms, and it depends on what symptoms you're talking about. So if it is the infection, that's good that your child is not having signs of infection, cough, catarrh, fever, or mouth breathing. If your child is not having any of that, so that's good. But to say whether your child has outgrown surgery, I will leave that to the ENT doctors because it is not just about your child being treated for tonsillitis. Is your child having obstructive sleep apnea? Is your child stopping to breathe at night? And all that. And then we usually will talk about outgrowing by the age of 6. Usually by the age of 6, if the tonsils or the adenoids are shrinking, yeah, and then it's obviously the surgeons will not want to go and operate the child. So if your child is free from the recurrent infections, which is what I think you are alluding to, that is good, but that does not automatically mean the child does not need surgery. So the surgery, obviously somebody must have talked to you about surgery before. So the surgery is something the ENT doctors have to decide. But trust me, doctors don't like cutting children. No, I know people think surgeons like to cut. They don't. Nobody likes to cut children. Even adults, we don't like cutting. So if people told you your child needs surgery before and you don't feel like doing surgery, just trust me that it's not because they want to do that surgery. The doctors will be happier than you if your child does not need any more surgery, because that is their own goal. Nobody wants to go, because there are lots of risk of surgery, the anesthetics risk, the surgical risk, so many risks. So if we can avoid surgery, we also actually want to avoid surgery. But if your child needs surgery, the child needs surgery. So by the time a doctor tells you your child needs surgery, it means they have no alternative. That's why they say the child needs surgery. So I just want you to know that, so that you don't get unnecessarily upset if they tell you that your child still needs surgery. I know most parents don't like surgery as well. Trust me, the doctors too don't like surgery. So, but sometimes there are things we just have to do. So but I would just say, please see your doctors again. Let them reassess your child. They are going to be happy if the child is doing well and the child does not need surgery. Okay. But if the child is having obstructive, these are things that can kill a child. If the child is having obstructive sleep apnea, the child is forgetting to breathe, the child can just pass that way. So we're not going to leave that to happen. Sometimes you have to do it as an emergency surgery. So, but if the child does not have any of those kind of life-threatening complications, of course, they will not do any surgery. Major Havers, welcome. I'm happy to see you. You're always consistent. Okay. Give blessings. Say good evening, ma. Please, my 6-year-old has not grown up his two upper teeth. Okay. When did they fall off? Okay, so if it's more than a year that they fell off, please see the dentist. They will still grow, but the dentist will be able to tell you, because you know what, the dentist can do an x-ray and the teeth are already there. All those teeth are already inside. So the dentist can see them in their x-ray, and they will be able to tell you, they will be able to show you and tell you, okay, see the teeth, they are up there, they are going to come down very soon. But if you are worried, the dentist will say if it's after a year that the primary or the temporary teeth fell off, the milk teeth fell off, and the permanent teeth has not come up after 1 year, please see the dentist. The dentist wants to see you every 6 months anyway, so it's also another opportunity to just go have a chat with your dentist, and they can easily confirm for you whether the teeth are there or not. So nothing to worry. Most of them will have their teeth. I have not seen a child who don't have teeth. Must be one of those rare conditions that children don't have teeth. All right, I've taken an extra 7 minutes. Thank you so much, everyone. Have a wonderful evening. And please watch out for our ATP anniversary. Be a part of it. And please celebrate with us. And happy Children's Day to all the children. Have a wonderful evening. Bye bye from me. Bye.